needed at this time. A, accompany the client to her room to get dressed. B, put the client in seclusion. C, tell other clients to ignore the behavior because it is harmless. Or D, tell the client that the behaviors have to stop right now.
A.
It's A, accompany the client to her room to get dressed. All right, 3, the nurse assigned to work with a depressed patient and wants to make sure that her initial contact does what? A, addresses the root of depression. B, keeps communication open. C, establishes trust. D, raises the patient's spirits. What do you think? The answer is B, keeps communication open. All these other things, the establishes trust is what students want to say. That takes a long time, and keeps communication open would facilitate that, okay? Raises the patient's spirits and addresses the root of the depression are wrong. So you got to keep the communication open, and you got to do that in order to do anything else. All right, 4, a client with bipolar disorder is admitted to the psychiatric unit. The client is talking loudly, walking back and forth rapidly, and exhibiting a short attention span. Which of the following would the nurse do first? A, decrease the client's environmental stimuli. B, give the client feedback about his behavior. C, introduce the client to other staff on the unit. D, tell the client about hospital rules and policies. A, I think all of you got that. Decrease the client's environmental stimuli. So what are we going to do? Take them to a quiet, dark place away from other people. You're going to talk slowly. You're going to talk softly, slow, right? Okay. The nurse is teaching a 70-year-old man about his depression. Which of the following statements by the client would indicate that teaching has been effective? A, all old people get depressed at times. B, I'm glad I'll feel better in 2 or 3 days. C, I never knew depression could just happen for no specific reason. D, when I reduce the stress in my life, the depression will go away. What do you think? Three, I never knew depression could just happen. That's it. A is all old people. The word all should be your tip. I'm glad I'll feel better in 2 or 3 days. Is that right? How long does it take that medicine to work? Long time, right? Or more than 2 or 3 days. And when I reduce the stress in my life, the depression will go away. That's not documented anywhere, right? All right. The nurse is assigned to care for a client experiencing disturbed thought processes. The nurse is told that the client believes that the food is being poisoned. Which communication technique should the nurse plan to use to encourage the client to eat? A, open-ended questions in silence. B, focusing on self-disclosure regarding food preferences. C, stating the reasons the client may not want to eat. D, offering opinions about the necessity of adequate nutrition.
A.
It's A, open-ended questions in silence. He's not focusing on one food or whatever. He's suspicious of all of them. So you've got to give him that open space to express why he thinks the food's being poisoned, if he thinks it's all food, whatever. How he wants you to correct it. Number 7, a nurse is providing discharge teaching to a client being discharged on lithium. The nurse would emphasize that the client should report which of the following? A, black tongue. B, increased lacrimation, tears. C, periods of disorientation. D, persistent vomiting and diarrhea.
Is it the last one?
Yep, persistent vomiting and diarrhea. What's going to happen? Dehydration.
Dehydration.
And if he's vomiting and diarrhea, he's going to lose sodium. That's our salt connectors, right? Freud defined depression as which of the following? Depression is a reaction to a distressing life experience. Depression results from being raised by rejecting or unloving parents. C, decreases in serotonin and norepinephrine activity. D, depression is anger turned inward.
Is it C?
It's D.
Oh,
Freud said depression is anger turned inward. I don't get it, but that's what he said. He said a lot of things I don't get. All right, 9. Your patient tells you, I am just a burden. Everyone would be better off if I were dead. Nurses are aware that A, suicide talk is just an attention-seeking device. B, suicide is an impulsive act. It is not thought out. C, suicidal talk or ideation can lead to suicidal behavior. D, suicidal people seldom really attempt suicide.
C.
It is C. And all this information is on that myths versus the real thing, that chart. If you doubt me, you can go back and look. Okay. Number 10, your patient has taken an antidepressant for 3 days and the patient calls and tells the nurse he doesn't think the medicine is working. The best reply by the nurse should be, A, I'll tell your doctor now and he may order a different medication. B, these medications usually take a few days to bring about an improvement in symptoms. C, the important thing now is getting you more involved in patient activities. D, it is important to eat a more balanced diet and help this medication work.
B.
It's B. These medications usually take a few weeks to bring about an improvement in symptoms. Carolyn, what are you saying? Your microphone is off.
I know. I'm always talking to myself in here. I thought you said a few days. It is correct. It takes a few weeks. It never takes just a few days for these medicines to work, right?
Yeah, right.
Okay. Cool.
Oh, I said days, but it says weeks right here. On this paper, it says weeks. Yeah. Good. You picked up on that. I'm glad I could correct that. All right. Number 11, the physician orders lithium 600 milligrams TID. Y'all know what TID is, right? 3 times a day. Okay. For a newly diagnosed client with bipolar 1 disorder, the toxic range for acute mania is A, 1.5 milliequivalents and above, 10 to 15 milliequivalents, 0.5 to 1.0 milliequivalents, 0.8 to 1.5 milliequivalents. What do you think?
Is it A?
Yes, it is. The thing that gives it away is the amount, first of all, and it's the toxic range. You have therapeutic ranges and other ranges, but I'm interested in toxic. So it's 1.5 and above. That chart gives you the above and what goes on, okay? 12, a patient is admitted for major depression. The nurse should expect to find which of the following when assessing the patient. A, anhedonia, feelings of worthlessness and difficulty focusing. B, depressed mood, guilt, pressured speech. Sorry, Miss Newton is buzzing me. Where did I get to? B, depressed mood, guilt, pressured speech. Changes in sleep pattern, tired, grandiose mood, difficulty focusing, feelings of helplessness, flight of ideas. What you got?
The last one?
Nope. The last one includes, it's good right up to where it said flight of ideas. That's
okay.
the depression. That's the mania part. Okay. So the answer is A, anhedonia, feelings of worthlessness, and difficulty focusing. Okay? All right, 13, a patient has a history of suicidal ideation. the nurse understands that the patient is at highest risk for self-harm at which of the following times? Immediately after a family visit, on the anniversary of a significant life event, C, during the first few days after admission, D, approximately 2 weeks after starting antidepressant medication.
D.
It's D. Approximately 2 weeks after starting antidepressant medication. Okay. He now feels better and he's able to do it. Has the energy. Okay, 14. Which of the following indicate major depression? Select all. You are not going to have a select all on your exam.
Well, do you know we had like 3 on the exam today?
3? You're kidding me.
Yes, ma'am, we did.
Yeah, we did.
Were they awful?
No, they weren't awful. They weren't awful. And we went over them. We went over them in a review, but they weren't on there.
Jennifer says it's awful.
Oh, I didn't think it was awful because I remember us going over them. But yeah, it was 3 of them on the exam today.
Well, I'm sorry.
And then we had 1 on the other exam, but on the first one.
I'll check the next exam to see, to make sure, to make sure this question right here is not on it. All right, which of the following indicate major depression? Select all. A, hopelessness, B, sadness, C, motivation, D, increased self-esteem, E, weight loss. So the answer is A, B,
A, B, E.
yeah, because hopelessness, sadness, weight loss are all part of it. The motivation and increased self-esteem would not be part. So that's an easy one. I mean, I hope I'm going to take it out if it's on the exam, and I'm sorry you had those 3, and I'm making myself a note right now to get that out of there. And that was exam 3, right? Exam 3, select all. Okay, I'll take those out for the next group, not for you. Well, it could be on your final. Okay, 15, an irrational fear is known as A, a flashback, B, a hallucination, C, a compulsion, D, a phobia. Okay, so you fear spiders and you might fear, yeah, phobia is the answer. Okay? That's where agoraphobia comes in, if you're afraid to go out and all that stuff. Okay, the depressed patient begins to cry and states, I'm just really sick of feeling this way. Nothing ever seems to go right in my life. The most appropriate response by the nurse would be, A, don't cry. Try to look at the positive side of things. B, you're feeling really sad right now. It's a hard time. C, hang in there. Your medication will start helping in a few days. D, nothing ever goes right.
D.
It's B, you're feeling really sad right now. It's a hard time. So that, thanks, Carolyn. Carolyn's gone. Yeah. All right, the overall goal of psychiatric rehabilitation is for the client to gain A, control of symptoms, B, freedom from hospitalization, C, management of anxiety, D, recover from the illness.
Is it A?
It's a A, okay? Control of symptoms. We are not going to make them recover. That's why D is wrong. Management of anxiety, they're way past that. Freedom from hospitalization, that's not one of them. All right, which of the following is not true about depression? It's more common in men than in women. It's common after myocardial infarction. Grief after a major loss can mimic depression. Children and adolescents can suffer from depression. Which one is not true? Okay.
A.
A, it's more common in men than women because it is more common in women than men, right? Carolyn, you're killing me. Okay. A client with depression is admitted to the hospital following a suicide attempt. Which nursing diagnosis would be most appropriate at this time? Now, we're talking about nursing diagnoses, okay? A, disturbed body image related to depression. Imbalanced nutrition, less than body requirements related to depression. Bathing self-deficit related to depression. Bathing self-care deficit related to depression. And D, risk for self-directed violence related to depression.
D.
It's D. It's risk for, that's a safety, right? Risk for self-directed violence related to depression. All right. 20, the nurse is instructing a 53-year-old female client about using the anti-anxiety medication lorazepam, which is Ativan. Which statement by the client indicates a need for further teaching? A, I should get up slowly from a sitting or lying position. B, I shouldn't stop taking this medication abruptly. C, I usually drink beer every night to help me sleep. D, if I have a sore throat, I should report it to the physician.
C.
What you got? 3, it's the use
C.
of alcohol. Yeah, it's the use of alcohol. Alcohol and medications don't do very well. She might sleep, but it might be the big sleep, right? The forever sleep. Okay, education for the client taking MAOIs should include which of the following? A, fluid and sodium replacement, frequent drug level signs and symptoms of toxicity. B, lifetime of continuous use, possible tardive dyskinesia, advantages of an injection every 2 to 4 weeks. C, short-term use, possible tolerance to beneficial effects, careful tapering of the drug at the end of treatment. D, prohibited concurrent use of over-the-counter medications without physician notifications, tyramine restricted diet.
The last one?
Yeah, the tyramine is the tip-off. Can't have anything with tyramine in it. Patient rushes up to the nurse and says, they're after me. They want to torture and kill me. What's the most appropriate response? A, tell me who they are. B, they're not here yet. C, I need to go look for myself. D, you're safe here. Tell me more. It's number 4. That's right. 4 is the good answer. The rest of them reinforce that there is a they. Okay. You don't want to refer to the they because there is no they. Okay. 23, which measures should be included when teaching a client strategies to help promote sleep? A, keep the windows open. B, eat a large meal before bedtime. C, go to bed when you feel tired. D, avoid caffeine, alcohol, and stimulating drugs before bedtime. So it's the last one, right?
D.
Yep. All right, 24, the nurse is teaching a client about nutrition and his lithium medication. The nurse instructs the client that a lack of dietary salt intake can have which effect on lithium levels? A, decrease. B, increase. C, increase, then decrease. And D, no effect. It's B. It would increase it, right? Given the following, this is the last one. Given the following information, which suicidal patient is at highest risk for carrying out a suicide plan? A, a patient who plans to take a bottle of aspirin. B, a patient who says my life is over. C, a patient who has a plan and the means to carry it out. D, a patient who says my family hates me.
C.
It's C, a patient who has a plan and the means to carry it out. Okay, y'all did well on that. I'm sorry I don't have the whole thing. I'll have it for the next class. How's that? Mercy. Really?